Patrick Nelson joining us now in studio, and you know, this is the time of year where things can be crazy on so many fronts, and you're always giving us a heads up about where criminals are looking to take advantage of people, especially like I think of my 89-year-old mom. Yeah. It's great that she's so independent, but when people try to take advantage of her, well, that really gets me fired up.
It's frustrating, and like so many of these scams and fraud that we talk about, it all starts with a random phone call, and when it comes to health insurance, people are making big decisions, and they're stuck with these decisions
for the whole year,
for a long time. And so what we learned from the experience of a woman in Pueblo West is you got to be careful who's on the other line when you're talking to them.
When he called and said, "This is Kaiser, this is Keith from Kaiser," so I thought it was.
Shirley says she was waiting on a call to figure out her health insurance benefits, but it turns out this call was nothing but trouble.
And they also lied to me and said that I was going to get a better cost on all my new policy information.
Thinking she was talking to her actual health insurance provider, she spent a long time on the phone with people she didn't know, giving up sensitive information and medical details.
He transferred me to one of his secretaries, and she took down the same information.
Eventually, she felt something was off and called her health insurance provider directly to get some answers.
I called Kaiser and they figured it out. They said that number that you gave us, that they gave you in the name, is a fraud.
In November and December, they really do a full court press here.
CSU Global's Dr. Fraud, J. Michael Skiba, says these calls are happening a lot right now, and fraudsters have plans for that sensitive information they're after.
And they're going to try to make you make a quick decision and engage with them on releasing some information. So what are they looking for? Well, they're looking for tidbits of personal information on you. They're looking for names, addresses, they're looking for doctor information, prescription information, medical treatment info, because what they can do with this is they can actually use it for other identity theft purposes, such as filing for benefits in your name.
Shirley shared her experience with her daughter, Natalie, who is helping her keep an eye on accounts and the potential for identity theft. Natalie says her mom did the right thing, asking for help.
Don't be afraid to talk to your friends, and it's always, you don't want to say anything because it's like you feel shameful or you feel hurt, and don't feel that way. You know, it happens to everybody.
Well, I'm doing this so that it may help other people realize that they're very vulnerable, especially this time of the year, and to be careful.
So here are some red flags to look for from the FTC that mean you should hang up if anyone calls you about health insurance. First, if they claim to be from the government and need money. If they say you need to pay for a new Medicare card. And if they're trying to sell you a medical discount plan. And lastly, if they say they need sensitive information in exchange for a price quote. The bottom line is, don't let anyone pressure you. You don't have to give up information or pay anybody that you don't want to. Just hang up, talk to someone you trust. We have more information to help you out to identify these calls. If they're not above board, you can just find that information right now on our website, KOAA.com. We're going to have more News 5 Today after the break.